welcome everyone to the SPX Talk in English. My name is Joep Pamen. I will be hosting this on behalf of SPX. Thank you for joining us because we know you're super busy. Some of you may actually be on vacation, and so we appreciate it even more. I have a quick public service announcement. You can already kind of jot down a save the date in your calendars. We have our annual conference on the 6th, 7th, and 8th of October of this year, and it will be in Luxembourg, where it will be part of the Luxembourg Health Week. This is an interactive session. I'll initiate it with some questions to our guests, but we'll definitely leave some time at the end for your questions. So our topic today within patient experience is communication, and even the best healthcare systems fail when communication is poor. This can lead to mistrust, fear, confusion, and frustration, and is totally counterproductive. So we are honored today to be joined by an expert in the field. He joins us from Poland. It's Adrian Goretzki. He is the founder and president of the Healthcare Education Institute. He also, from 2010 to 2018, led the Polish Association for Patients with Primary Immunodeficiencies. As an experienced patient advocate, trainer, and consultant, he focuses on patient engagement and education using innovative methods like online courses and video tutorials. He will provide insights on mastering empathetic communication and share strategies for enhancing patient-provider dialogue in high-stress environments. And Adrian has known some very high-stress environments, like many of you, I'm sure, but particularly in Ukraine recently, which is a very specific environment. So maybe, Adrian, to get us started, can you kind of go through the highlights of your career and how patient communication has played a role in it?
Mm-hmm. Sure. Thank you. Thank you for the invitation. I thank you for all the participants that decided to spend this half an hour with us. Well, I started my career when I was 18 years old, 17 years old, in fact, with being a volunteer in the Polish Association for Patients with Immunodeficiencies. Then I became a board member, a president, and I served for nearly a decade as a leader of this association. So there was a single disease, or rather a single group of diseases, patient association focused on the national level. And also I was a board member for a cadency of the International Patient Organizations for People with Primary Immunodeficiencies. And since 2017, I have been running this foundation, focusing myself mostly in education of patient advocates, but it's not limited to. When it comes to communication in my career, it plays a crucial role because I was communicating to patients. From the very beginning, as a leader of the patient group, our main job, besides advocacy, I mean the policy advocacy, was communicating to patients. First of all, it was communication regarding an access to treatment. So where to go, where to get a diagnosis, where to get treatment in the, let's say, in Poland, within Poland, because it was not like it was available everywhere. How to advocate personally for the treatment if it's not available. And then after solving this issue on national level, we focused mostly on communicating how to live with the disease. So we, for example, created handbooks in simple language, like this is a psychological handbook for patients with PID, life management, we would say, and this is like medical handbook for patients with PID. So everything after diagnosis, what should you do? So we published handbooks, published a documentary video, and many other communication projects, mostly to tell patients in simple language what to do with the disease. And then, just to quickly summarize this, also we for many years we did trainings for patient advocacy and communications with physicians about communications, the hardest training we ever had to make them use a simple language, and many other projects like this. So yes, communication played a crucial role in my career from the very beginning.
Thank you, Adrian. And given this experience, can you share some strategies and tactics that you have seen to be particularly effective in this area?
Well, yes, simple language. Simple language and making sure that the patient know everything before hospitalization, patient know everything about the hospitalization, and patient feel informed. So, well, we know that hospital is a total institution like prison, because there are uniforms, there is a hierarchies, there are some rules, and we cannot change the nature of hospitals. So, but we can change the communication regarding this and make it more human experience than a total experience. So when we were cooperating with hospitals, we were also focusing on this. So how to make the stay of the patient the most, the best possible when it comes to simple language communication and communicating everything. The communication also should be total. So from the very beginning, from prophylaxis to the hospitalization and after the hospitalization, this was our priority in this area, cooperating with hospitals.
You clearly come from the kind of patient advocate side. What have you done to balance the need to clearly advocate for patients and at the same time work constructively with healthcare providers? You alluded earlier to the fact that the sessions with doctors have been particularly challenging. So maybe you can talk a bit more about how you managed to find this balance.
Well, it depends mostly on the situation that you have. If there is no access to treatment, you have to be a barbarian at the gates. You have to fight, and sometimes you have to fight with the hospital. So the job of patient advocate is like our first and most important task, if there is a treatment, is providing the access to treatment for the patients, the reimbursed treatment. So sometimes you need to fight with hospitals also. But in general, when it comes to communication, we cooperated with many hospitals. We did many trainings for medics, not only for physicians, but also for nurses, in simple communication. It was quite easy with nurses, but it was very challenging with physicians, as they declined using simple language in many cases, because they thought that everybody understands, because everybody had biology in school, so we should understand everything they are talking to us. So I remember my wife asked them something from physics, and nobody knew this, but we all had physics at our schools. So yes, it was very hard. What we made with them was workshop, from making a complicated message, making it as simple as possible, as simple as for the 13 years old person just we finished a couple of classes of school. This was always our goal. Now it's easier because you can use artificial intelligence to make texts easier, but you still cannot do it when it comes to the talking, and physicians avoiding simple language are still a problem in Poland. This is still something we kind of trying to address too.
So given what you've just said, Adrian, what advice would you give to healthcare providers who, to make sure their patients feel heard, informed, and engaged?
Well, having this experience and having experience with Ukrainian refugees, because we were the first line to get those refugees, so our foundation had a project together with urologists. We moved almost more than 100 families of people with rare diseases to get a treatment in Poland. So it was a problem because they were, for example, it's an example, they were used to have much longer hospital stays than we have in Poland. It was a problem in Poland as well, shortening the time of the hospitalization. So what we try to communicate to them in the very beginning by providing leaflets and recording videos is that you need to expect shorter hospitalization, and this is not something this is not because the quality of care in Poland is lower, but it's because it's proved that this works better. So we prepared them to be hospitalized in Poland. We also prepared them basing on the most frequently asked questions by them, that there is no corruption in healthcare in Poland, because unfortunately this is something they have in their everyday lives in Ukraine. They have to pay physicians for everything, despite this is a public healthcare. So they don't need to pay for drugs, they don't need to pay for the procedures in hospital. And when it comes to Polish patients, we did say the same, using simple language, using the examples why it works like this, also referring to some research that this is a proven research. This is not like the hospital is trying to cut costs on them, but it really also have an impact on the results of their treatment, less risk of getting infected in hospital, etc., etc. So we always provided facts, always provided data, but in the form which was easy to digest for the majority of people, especially those without any kind of formal education, finished just with the basic school education.
Yeah, it's fascinating how something which may seem extreme, like welcoming the Ukrainian refugees, actually gives you insights and forces you to think about what are really important elements of the patient experience, like managing expectations, which you refer to. That's really an interesting experience.
Oh, I believe it is, but let me just remind one example from our trainings for physicians that they find innovative, that they can introduce themselves to patients. This was like a bright idea. Oh, we didn't do this before. Maybe we should. So it's not, you don't need to have a war at your border to find something which can be really groundbreaking, like introducing yourself to patients when you're a physician. But yes, I mean, this experience gave a lot of out of the box ideas, thinking patterns, because we needed to deal with this here and now. Yes, there was no time for creating a strategy. So also we did a lot of communication materials for those patients.
Maybe, Adrian, on the point of differences, I know you're based in Poland, but you have a very international view. Maybe you can give a couple of examples of where you've seen striking differences in the way there is communication between the healthcare providers and the patients across various countries. Anything that comes to mind where you say that's really different from what we do in Poland or what you've seen elsewhere?
Yes, I mean, there are differences also based on cultural and historical matters, because I can share one from Poland. We are fighting, this is a good word, with an indirect speech in medical language in Polish. Because we have it comes from the times of the communism, of course, that the person and also patient was not a subject, only the citizen was a subject. And people in healthcare, especially the older doctors and nurses, still are using the language like, not please sit down, but he sits down or she sits down. Yes, and this is the kind of custom that we have in Polish healthcare, and it's like, it's gets off all your dignity you have as a person. So we have this because of the communist times. It's good that they do not call them citizen or comrade anymore, but still uses this language. And it's indirect speech, which is bad. So this is an example we have in Poland, and I know that in a couple of other Central Eastern European states we have this. We have countries with very good level of communication. I find France has a good communication system with patients. And the system which have a person which is dedicated in the hospital to communication is better than ours. It's better than those we have Central Eastern Europe. There is a progress in this, but having a communication specialist on board helps very much. internal communication specialists or people who are dedicated to patients, but they are not physicians, like the assistants. They help very much. In our part of Europe, it's introduced slowly, but I know that many countries there are patient assistants or communication assistants at the hospital wards, and I can see that this is a very, I mean, having such a role, such a person at the ward in the hospital is a groundbreaker. It's a groundbreaking experience for the patients, because not only the physicians are communicating to them, and the physicians are always perceived as part of the total system, totalitarian system in the hospital, but those patient assistants are more humanly oriented, and they are perceived as friends and not as somebody higher in the hierarchy by the patients, as partners in the treatment process. So from the differences we had, first of all, something that came from the communities, but also something which is not being introduced. I mean, this patient assistance or communication assistance, which also is a crime changer, and is something common in Western Europe and still uncommon in the Central Eastern Europe. So those are the differences. I can talk long about the differences in Ukraine, because this is another word also to us. Maybe we've been in this moment like 20 years ago or 25 years ago, but their system is completely different when it comes to the physician attitude toward patients and general attitude toward patients. Like they are still not subjects of the treatment, totally no. But when it comes to ours, I can see a lot of progress, and I'm very happy about this. So, well, I think this is reality differences.
Yeah. Very interesting, Adrian, and I'm sure as we are joined on the call by people from the UK, from France, from Portugal, from Belgium, etc., I think we're all familiar with the cultural differences and how tricky it can be to deal with them, and cultural differences both on the staff side and on the patient side. So thank you very much for kind of giving us these examples. I'll ask you one more question before we open up the questions for the floor or for the participants. How do you personally see the evolution of patient experience in the next couple of years, next 5 years? What's your view on how patient experience will evolve?
Well, I won't be Elon Musk. I won't tell you that it will be treated like autonomously without any ingression of human, because I believe that the human factor here plays a role and will always play a role. I would just say that that is going towards the individualization of healthcare, which is good. That it's going towards the putting a pressure on the prophylaxis, so preparing patients to medical procedure. Doesn't matter whether it's a lifelong treatment or it's a surgery in a hospital. So preparing patients to get the best outcomes for the patient, but also to have this patient more adherent to the therapy that we are providing him or her with, because this also affects the compliance level, any kind of prophylaxis, and informing the patients not just through the the paper version of their results and some advice, but also having honest conversations with them using simple language. So individualization of healthcare, making it more human, and also the easy language. Those are the trends I see in the patient experience, and I strongly believe that this will lead to better results from the psychological point of view, which affects greatly the effects of the conventional treatment, but also from the side of the treatment. Yes, that we will have happier patients with higher level of comfort in the hospital during the treatment, with better results of the treatment, thanks to this.
Great. Thank you for your perspectives on this, Adrian. So we'll open up the floor to questions. Feel free to put them in the chat or raise your hand, whatever works best for you. We're a small group, so we can definitely chat. Anybody with a question for Adrian? We have one from Lee. Do you want to voice your question, Lee, or?
Yeah, it's just in certain situations we'll be actively involved in conversations where there is the clinician, healthcare professional, patient dynamic, and we get to that point that information needs to be passed across, either information about a new diagnosis or information, Adrian, as you showed, in terms of written information to support things going forward. From working within our approaches, I suppose within the NHS, I often still see that people go into fixing mode from the healthcare side and don't necessarily consider that the other individual in the conversation is ready to learn about that new information. And that aspect, I suppose I spent a time working within forensic mental health care, and often people that new florid psychotic diagnoses, actually giving information at that point adds no value. And so, other points where there's stress and anxiety, should we be really considering more assessments, whether they be formal or informal, to understand that that person is ready to receive more detailed or technical information?
Yes, definitely yes. My answer is yes, and it could be both informal if the professional is ready to assess it, because as you mentioned, in most cases they don't do it. They rather provide fixed information like for everybody else and anybody else. And when it comes to the formal ways, I mean, we are in a position that patients need to fill out some questionnaires before being hospitalized anyway. So we can ask if they would like to get more detailed technical information, or we should stay with simple language, because I believe the patient will answer honestly, because we need to point out that this is not about, we won't differentiate the quality of the information we are providing. So, I mean, the key findings are the same, but we can differentiate it based on the language. So I believe that, for example, Polish immigrants in the UK, the fresh ones would go for the easy language, and many other people like this can go the easy language. But when there's somebody who would like to get more detailed information, we can stay with technical language. And I believe that, I mean, giving such an obligation to the physicians to do it will play a role, a vital role. I mean, its obligation will play a role that they will start using simple language, because they don't want to, as we know from our research, as we know from our trainings. This is a very good point.
Thank you. Cheers. And I suppose, are you aware of any quick assessments that work well, or anything that you have used?
So the question because, well, in many countries you need to fill out the form about yourself in the beginning, about, I know, food allergies, things like this, yes, before being hospitalized. So adding a question regarding if you would like to have this information provided in simple language, or would like to have more detailed, maybe not, I mean, not to make the patient misunderstand this, like when you use simple language, we won't provide less vital information. It's not like that. We provide the same information, but the form of providing is different. You can choose the simple language one or the full professional English version. Yes, I feel it. I mean, this is the easiest way to do it when it comes to formal one. Not asking about, I mean, I will do it with the consent of the patient, not like asking about level of education, level of, no, because this is not the right thing. We shouldn't assess people just by their education and social status, but ask them directly whether they would like to have it in a less easier way that is easier to digest, or they would like to get the full information in medical English. This is what I think.
Yeah, that's great. Yeah, I definitely think there's a power in asking that question and yeah, almost asking permission to give further information at that point. Yeah. So thanks very much for that.
Great.
Welcome.
Thank you, Lee. Thank you, Adrian. Anybody else have a question? Again, feel free to put up your hand or put it in the chat, whatever works best for you.
Hi, everyone. Can you hear me?
Yes.
Yeah. Hi. So my name is Rita. I'm based in Geneva. Hi, in Switzerland. And I have a question in regards to those questionnaire that we usually send to the patient before the hospitalization. Was there any idea or project to ask the needs in terms of health literacy before the hospitalization? Is this something that you've been doing, or you thought about, or you've experienced?
We were advising to do this. Unfortunately, we are not sending those questionnaires in Poland. We are giving them patients on the arrival to the hospital. But still, I think that adding this question is a good option. I mean, we're advising it to the hospitals. I don't know if anybody introduced it. In fact, we didn't check it. But asking about the level of literacy when it comes to healthcare is good, because I believe, we haven't checked this, we can do a research about it, but from my experience, I suppose that people will answer honestly, because there is no added value to them from the information that they wouldn't understand. Yes, so this is useless, and from what I know also from the research we did with patients and their quality of life, burden of treatment, burden of therapy, that they usually don't understand those messages from physicians. So if they usually don't understand it, giving them a choice to understand this by just picking the right tick on the questionnaire, I think this works well. And I think, as also Lee pointed out, we shouldn't do it informally by I don't know what, in fact, by the suit I'm wearing, but mostly about the honest question, if they would like to have it in the simple language or in medical terms. Yes, and I am dreaming of it, and those physicians that they in the end need to learn this easy language and how to communicate with patients in this way, because they will be obliged to do it. Yes, this is another thing how they will do it, and perhaps there is a need of workshop from medical German or French or Italian when it comes to Switzerland to them. But having this obligation, I think it would change the landscape of patient communication in this matter.
Okay, thank you. Thank you.
Great, thank you. Anybody else have a question for Adrian? Or he has been so super clear, and it's true that we have time for just one more question. Anybody?
May I?
Certainly, Rui.
Well, just one last question. It's not really a burning question, but has to do with a specific use of AI. We are really living in the age of AI, and you mentioned about that you also prepare some materials using AI models and tools. And I was really wondering what will be, from your perspective, the plus and minus of adopting AI. And also, we would like to know if you have more actionable results from your experience that you can share with us in this respect.
Sure. Well, AI, I mean, the language models, the generative language models of AI are powerful tools to use also here, because when we were writing this or another books, I mean, the patient management books, we couldn't use of it. Now we can. And what is the easiest way to use it when it comes to communication is just writing a good prompt to make those information that you have prepared a lot of material as like we had, we can put it into the AI. It could be ChatGPT Premium or another one. It doesn't matter at this level. We mostly use the open AI tools and ask them to rewrite the text using simple language as for the 13 years old user of the language, without but still passing all the information. Is important to get this in this prompt. So passing all the information, but in a way that is easy to digest for the 13 years old person, because this is the level. I remember from my times being a journalist back in the days, also working as a journalist, it was the level we have set for our text to be understandable for the 13 years old. And I feel this still works. So this could be an easiest way of using AI, because many research prove that message from the AI are comes to healthcare, and people prefer messages from the AI than messages from physicians, which is not a great surprise to me after those trainings. But you can use this, so making your existing material simpler, and it's easy and it's almost free. When it comes to creating something from scratch with the AI, I would be careful by now. Now in this position with this advance of this technology, I would stay cautious, because it's used many information also from the sources which are not reliable, or making up information sometimes. So we always need to be checked by a medical professional. Still, we haven't been using it to make materials for patients from scratch. It's always our input is being transformed by the AI, not as use it on the very large scale in our courses, because all our courses, online courses, are translated with lip sync to the language of the attendees. So we make sure that it's available to everybody. Those courses for patient advocates from other countries. We use this to make our material simple. We use this also when it comes to live meetings like this one, so they could be translated to any language with text. But it's still working on something that you previously made. It's human-made, and it's just transformed the way that we would like to by the AI, not creating something from scratch. I believe also, this is something we advise people, advocates in the developing countries, that it's better to have an AI-created material than nothing. But still, they need to get it verified by medical professionals. So this is what I see here, and also using it in bots, as Gita just pointed out. In bots, this is something good, because it also this very basic things like this are in Poland, because then you can have less people at the registration desk, at the client service desk at the hospital, and people can get information, the basic information, like they're always asking about, what to wear, what you can get at the hospital, etc., etc. Yes, so chatbots are always also okay, but I would be cautious when introducing chatbots for patients with a specific disease. Yes, but when it comes to using the facility and being hospitalized, it's great, and being directed to the right word. But when it comes to the information about the disease, I would be cautious and still ask somebody to verify the information provided by chatbot, so or by AI. But working on your content that you have already developed, it's a great fun, and you can hear yourself speaking in Swahili or Malay after using this with lip sync. This is kind of very interesting experience, but you can provide this material after verification to patients in any language, in any part of the world.
Great. Thank you, Adrian. I will have to stop you there. Thank you very much. It's been very interesting. We have in the chat a couple more dates that you can maybe mark in your calendars. thank you very much for attending, all of you. Greatly appreciated. I'm sure we'll have many other conversations with Adrian in future. So I wish you a very pleasant afternoon, and thank you. Bye-bye.
Thank all of you. Bye.